Hello everybody, hope you're doing well. Welcome to RT Test Tip Tuesday, RT Tips by DW. Looking at this question, there's a few things to look at. First off, we remembered that with the MBRC exam, you're going to have recall questions, application questions, and analysis questions. Those are pretty much the three different types of levels of questions that you'll have. And then obviously we're going to build upon have to utilize bits of information that we've learned throughout the respiratory therapy program in order to be able to apply it to said situations and so forth. So if we take a look at this particular question, we can see that the following values are obtained from patient ventilator flow sheet data. At 2 o'clock, 3 o'clock, and 4 o'clock, we see that our tidal volume is 745 milliliters, while our peak inspiratory pressure at 2 o'clock is 37 centimeters of water pressure. Our plateau pressure is 34 centimeters of water pressure. We'll also notice that at 3 o'clock and 4 o'clock, our tidal volumes are 745 milliliters each. So some other information that can be deduced from this is that we are in a volume control mode of ventilation. And then if you think about the aspects of volume control ventilation, you remember that if you're in volume control ventilation, volume is constant while your pressure is going to be variable. The opposite would be true if you're in pressure control. While pressure control is constant, or pressure is constant in pressure control, your volume is variable. And in both cases, we tend to look at compliance and resistance. So we've got to have an appreciation for compliance and resistance. So disorders that are going to have an impact on your compliance, disorders that are going to have an impact on airway resistance. So you've got to be able to fall back upon all of that prior knowledge that you've gained when looking at this particular question. You've also got to understand a little bit about static compliance, dynamic compliance, and again, take into account conditions that can have an impact on an increase in airway resistance or a decrease in airway resistance, and those conditions that might have an increase in lung compliance or a decrease in lung compliance, and then have an appreciation for what happens to your peak inspiratory pressures in the event that your airway resistance goes up, if your lung compliance goes up, or if your airway resistance goes down, or if your lung compliance happens to go down. So we'll take a look at what's scheduled or what has occurred over the last 3 hours, and then we'll try to tackle this multiple exam items. So rather than it just simply being an A, B, C, D answer choice, you'll notice that there are Roman numeral selections here where you've got to try to decide if each of those are going to be included. So again, looking at 2 p.m., or it doesn't delineate whether it's a.m. or p.m., but nonetheless at 2 o'clock, tidal volume is 745 milliliters, peak inspiratory pressure is 37, and your plateau pressure is 34. Remember, your plateau pressure is going to be indicative or pretty much equivalent to what our alveolar pressure is, and we really want to try to keep those plateau pressures lower, or in many cases less than 30, like we can see. We also see that our peak inspiratory pressure has trended up over the course of it. So we started out initially with a peak inspiratory pressure of 37, and then it transitions to 40 centimeters of water pressure, and then it transitions to 44 centimeters of water pressure. So we tend to think about what we've learned with mechanical ventilation and understand that what is it that can cause an increase in peak inspiratory pressure? Can changes in lung compliance, if you have a decrease in compliance, can that cause an increase in those peak inspiratory pressures, especially in volume control ventilation? Certainly is. So in volume control ventilation, if your volume is constant, your pressures are variable, it would make sense that if there's a decrease in lung compliance, that could absolutely cause your peak inspiratory pressures to go up. We also notice that if you have an increase in airway resistance, meaning that the airways are a little bit tighter, whether that's through bronchospasm, inflammation of the airway, or secretions, that's going to increase your airway resistance, and that's also going to elicit a little bit higher peak inspiratory pressure as well. And we know that the plateau pressure, you've also got to remember, how do you achieve your plateau pressure? Well, you've got to have an inspiratory hold maneuver done on the ventilator in order to be able to achieve said plateau pressure, unless there's a time pause built in, but typically we don't breathe like that. So you're going to achieve your plateau pressure when you do an inspiratory hold maneuver for the patient by pressing the inspiratory hold button on the ventilator, or having the ventilator perform that maneuver, and then that'll give you your plateau pressure. So one thing that we want to try to make sure that we're looking at here is, if you'll pay attention here, our peak inspiratory pressure and our plateau pressure, 37 and 34 respectively. So if you can remember your trans-airway pressure is the difference between peak inspiratory pressure and plateau pressure. So simply you just take the two and subtract them from one another. So we've got a trans-airway pressure here of about 3 centimeters of water pressure. That's going to be important when we remember about trying to utilize this type of ventilator data to determine if we have a compliance or an airway resistance issue. So remember, if you have a decrease in lung compliance, you can expect your peak inspiratory pressures to go up. If you truly have a decrease in compliance, you would also expect those plateau pressures to increase while maintaining a fairly stable trans-airway pressure. But if you happen to have an increase in airway resistance, you're going to notice that your plateau pressures will remain relatively stable while your peak inspiratory pressures are going to be elevated, thus increasing the actual gradient or the delta between your peak inspiratory pressure and the plateau pressure. So the gap between the two is actually going to increase. So if you'll notice at 2 o'clock, you go from a difference in the two, or your trans-airway pressure is essentially 3 centimeters of water pressure. And at 3 o'clock, that trans-airway pressure has grown to 7 centimeters of water pressure. And now at 4 o'clock, that trans-airway pressure is 11 centimeters of water pressure. So we've gone from 4 to 7 to 11. So our trans-airway pressure is getting a little bit higher. Plateau pressure has stayed relatively the same, while our peak inspiratory pressure has gone up. We've deduced that we're in volume-controlled ventilation. So the problem that I have here is, in volume-controlled ventilation, volume is constant while pressure is variable. At the same drive or at the same delivered volume, our peak inspiratory pressure has gone up, all the while our plateau pressure has stayed relatively stable. So at this point, I'm not really thinking that I've got a decrease in lung compliance because my plateau pressure has stayed relatively stable. I would tell you that you could go through and calculate your static and dynamic compliance, but we're not really given quite enough information in order to be able to complete those calculations. It would be nice to know what the overall positive end expiratory pressure or PEEP setting is for these individuals to be able to calculate that. When you look at static compliance, assuming that there's not any significant ventilator changes and seeing that your plateau pressure, and if you remember the formula for static compliance, you can probably deduce that your static compliance is pretty much unchanged, or for the most part relatively stable. And that's going to be some important information as we transition further through this question. So I have deduced just from looking at this data set that I'm going to be looking for answers that are going to involve an increase in airway resistance because I've got an increase in my trans-airway pressure. So let me look at the overall answer choices. Which of the following statements about these conditions is most likely true? So I look at Roman numeral 1, static lung compliance is relatively stable. Again, if you know the formula for static compliance and know that you're going to subtract in the denominator PEEP from your plateau. Again, we're not given PEEP, but we can estimate that it's probably not, we can deduce that maybe it's not changed. So the fact that we've got a relatively stable plateau pressure lets us know that our overall static lung compliance, for the most part, is relatively stable. So I would include answer choice 1 with whatever I'm going to select. So by process of elimination, A is already out. I'm not going to mess with A. 2, lung compliance is decreasing. The fact that my plateau pressure is relatively the same, and I know that I'm witnessing an increase in the trans-airway pressure, I'm not convinced entirely that the lung compliance is decreasing. So I'm not gonna select answer choice 2. So anything that has answer choice 2 in it, I can eliminate. A is gone and D is gone. So now I'll begin to look at 3. Airway resistance is decreasing. Well, our trans-airway pressure says differently. So 3 is gone. Anything that has 3 in it is out. D has 3 in it, gone. It's not the appropriate answer choice. I'll look at Roman numeral 4. Airway resistance is increasing. Our trans-airway pressure, based upon the subtraction of our peak inspiratory pressure minus our plateau pressure, we know that over the course of those 3 hours, that has increased, and that is indicative of an increase in airway resistance, and 5 flat out states that the trans-airway pressure has increased. So if we look at the appropriate answer choices, static lung compliance relatively stable, yes it is. Lung compliance decreasing, that's not the correct answer. Airway resistance is decreasing. That's not the correct answer. So 2 and 3 you can mark out. 4 I would include in my answer choice, and 5 I would include in my answer choice. So this is the thought process that I would have going through this type of a question. Now, mind you, I'm just a little over 10 minutes explaining this question, and when you go to take your board exam, if you're taking the TMC, you have 3 hours to take 160 questions. 140 of those questions are scored for you, meaning they count for you, they count against you. 20 of those are test items. 3 hours, that's 180 minutes. So 160 questions in 180 minutes, you really have about a minute, a little over a minute per question. Some will take a little bit longer. Some will be quicker than others, so we can't take 10 minutes for each question. But nonetheless, I wanted to go over my thought process in moving through this type of an exam question that you might see in my class soon. Thank you for your time.